morning, ladies and gentlemen. Welcome to CNC 2017. We have a power-packed agenda and an all-star faculty for today. It is an absolute pleasure of mine to introduce Dr. William Zoghbi. We are grateful to him for his leadership, his vision, and his commitment to education. He is a Elkins Family Distinguished Chair in Cardiac Health, Chairman of the Department of Cardiology, my boss, at the Houston Methodist DeBakey Heart and Vascular Center, and Professor of Medicine at Weill Cornell Medical College and the Institute of Academic Medicine here at Methodist. Dr. Zoghbi is a renowned leader in cardiology, in echocardiography, and cardiac imaging. He has served as president of American College of Cardiology and has presided over national and international development of guidelines for evaluating heart valves. I welcome Dr. Zoghbi to get us started and moderate the morning session of CNC 17. Thank you.
Thank you, Alpesh. Good morning, everyone. What a pleasure having you here today on a weekend. I was reminded it was Father's Day tomorrow, but I know you're here. This is amazing, actually. I just want to give you, this is an inaugural conference, and it was full. We had to close it. And it tells you something about knowledge, the expansion of knowledge, and at times that it's really hard to keep up with everything that you are doing. It is hard for us cardiologists to keep up with all the developments and everything else that even affects us, with diabetes, with COPD, with so many other illnesses. And I am sure, and you voted by your feet today, that it is hard for you, if you're not a cardiologist, to keep up with all the changes that have happened in cardiology over the years. I can tell you, I was reflecting yesterday, I can tell you from when I finished cardiology to now, I don't want to date myself too much, but when I finished, almost everything has changed. Almost everything has changed. The only leftovers are diuretics and nitrates. Even digitalis is no longer left over. You don't prescribe it as much as we were, when we were in training, and it is really amazing. So we felt, Alpesh Shah and myself, we felt that there was a need for such a conference to update you on many things that is happening in cardiology, make it short and sweet, 15 minutes for each, and give you an update from ischemic heart disease to some valves, what is really going on. I met ophthalmologists this morning, primary care, nurses, nurse practitioners, and this is the audience. The audience here today is about 200. Almost half are physicians. The others are nurse practitioners, nurses, PAs, other healthcare professionals that cardiology touches your life, or you touch the life of cardiology patients one way or another. And I cannot but applaud you for being here today to get a refresher on what's really going on. And we have a wonderful program. We pride ourselves as loving education for the sake of education. You are in a building, it's called the Research Institute, the Houston Methodist Research Institute, because I need to tell you a few things about Methodist and what we're doing. And the reason for it is half of you are not in this healthcare system. Almost all of you, and we didn't go outside Texas because we wanted here in the family. So half of you are from Houston Methodist and all the branches of Houston Methodist. And the other half are in neighboring institutions or various parts of the state. The other interesting thing is also we're live broadcasting this. So for a very tiny fee, you can get an update at home, sitting in your but we'd like the personal touch. We'd like to meet you. We'd like this interaction because I really feel strongly that this interaction is important. Yes, at times, if you're in a different state, you can't do that. But I think this is really very important. So for us to give you a feel of what we are doing at Houston Methodist and our DeBakey Heart and Vascular Center, I'm going to run a video for you, just a 2-minute video to tell you how we're doing various things, so at least you'll get a feel for it before we start with the program. So why don't we run the video if you don't mind, and let's take a look at our offerings for you and how we're trying to.
Houston Methodist is a leading academic medical center focused on research, education, and patient care. The hospital system provides comprehensive medical services in all adult specialties, training for medical residents, and a groundbreaking research institute. Founded in 1919, the Methodist Hospital became a charter member of the Texas Medical Center in 1953, earning an international reputation for medical breakthroughs through the pioneering work of famed cardiovascular surgeon Dr. Michael E. DeBakey. Today, this legacy of medical milestones, coupled with outstanding patient care, continues to attract patients from around the globe to Houston Methodist. Houston Methodist Hospital has been consistently nationally ranked by U.S. News & World Report for its medical excellence, and is ranked as the best hospital in Texas. In addition to its flagship hospital in the Texas Medical Center, Houston Methodist is comprised of 5 community hospitals with a 6th under construction, 1 long-term acute care hospital, 4 emergency care centers, and 2 imaging centers. One of the Houston area's largest employers, with more than 17,000 employees, Fortune magazine has named Houston Methodist as one of the country's best companies to work for 10 years in a row. Unparalleled quality, safety, service, and innovation. Houston Methodist, leading medicine.
I know maybe some of you have also experienced, on the 5th floor of this building, it was really, you saw some of these pictures here, is an amazing place. 40,000 square feet. It's called MIGHTY, which is for innovation, technology, and education. It's all dedicated for education. Many of our courses that are hands-on and various things, and people need to have a refresher, are done here. And we touch, in so many ways, more than 14,000 learners per year, and we're really very proud of it. Education is really one of our missions.